My name is Ravi Krishnan. I'm a Mohs surgeon, and I work at Virginia Mason at the downtown campus in Seattle. I specialize in the removal of skin cancer and the reconstruction of the wounds that result from removing the skin cancer. And once I started becoming more involved in Mohs surgery, I just grew to love it even more. Sometimes there are just some very challenging tumors that are very difficult to remove, and I know that when I'm doing the Mohs surgery, there is really no other procedure that this patient could have had where we would have gotten this cancer out. The cool thing about Mohs surgery is when someone comes into my office and they have a skin cancer on their nose, I can tell them, there is a 99% chance that I will get rid of this, it will never come back, and most of the time, several months after the surgery when you're fully healed, it will be difficult for anyone to notice that you've had surgery. The main way that I try to make each patient feel unique is to try to focus on their concerns about the skin cancer itself. Because a lot of the skin cancers that come in, they're very similar, but the patients that have the cancers are different. And so I think it's important to focus on what the patient's goals are, fears are. Some patients, the biggest thing that they're worried about is they're going to die from their cancer, and then you have to explain to them that their particular cancer is perhaps not likely to kill them, especially after we do the surgery for it. Other patients, quite frankly, aren't that worried about dying from the cancer. They're worried that they'll be scarred or disfigured, and then we spend more time with them explaining to them the various reconstructive things that we can do to try to restore their appearance. And so we do all of those things for all patients, but to make each encounter unique, we try to focus on the one or two things that particular patient is most concerned about.